Hello, the topic of this video is total skin electron therapy, TSET. I'm grouping this together with total body irradiation, which was the topic of the last video, but they're clinically used quite differently, and the beam dosimetry is very different, but the similarity is the word total. So there you have it. I'm going to show some dosimetry and then get around to some other aspects of how this is used in the clinic. So here we go. It's used in the treatment of cutaneous T-cell lymphomas or mucosis fungoides. Here are the dose schemas used, 36 gray and 36 fractions, delivered 4 days per week. The goal of total skin electron therapy is to deliver a high superficial dose, but with a low dose to the internal organs. And so it's done with electrons, as you know, that treats higher dose superficially. You want to use lower energy. The main reason for that is that you limit the Bremsstrahlung component coming from both the head of the machine and from the patient themselves. That's delivering a deep superficial dose that you don't want. A lower energy has lower Bremsstrahlung, lower efficiency for production of photons. You typically would use a two-beam technique for this, and that avoids the central axis where this X-ray component is the largest. And here's what that looks like. One beam is tilted down towards the floor and one beam is tilted up, so the patient is never looking straight down the beam. It's off axis, and that avoids the central X-ray component. Second goal is to deliver uniform dose, 10 to 15%. And so this is achieved with a technique that has a sort of a rotation of the patient, or treating with 6 different fields in a various arrangement of body poses. Here's what that looks like in schematic. So on the first day, you would deliver where these large arrows are around the patient, these 3 angles. And then on the second day, you would deliver at these other 3 alternate angles. So it's a 6-field cycle. Second way of achieving dose uniformity is to put a beam spoiler on. The purpose of the beam spoiler is different than it is in TBI. It's used to improve the uniformity through the scatter of electrons, through a wide-angle scatter. It's also useful to deliver in high dose rate mode, because you're treating at an extended distance so that the patient can fit in the field. And so you need a higher dose rate coming out of the machine because of the scatter and attenuation of electrons in the air. So there are some regions of possible low dose, scalp, chin, perineum, sole of the feet, that don't see a direct electron beam. What you do for these regions is you can actually boost with another electron field directly on those regions. Also, you have to consider skin folds. Those can self-shield, and so you can consider boosting those with electron fields as well. All right, so there you have the basics of total skin electron therapy. There's a reading list here, but like TBI, there actually are not a whole lot of reports out there that give you background in this. So hopefully this video will also give you a good basic fundamentals on this important but rare therapy. Thank you.